The Department of Health and Social Care has apologised to the thousands of people who were infected with HIV and hepatitis C in the 1970s and 80s by contaminated blood. The inquiry into the biggest treatment scandal in NHS history also heard that former Prime Minister John Major refused to pay compensation to the victims, suggesting the National Lottery might be used instead.
On behalf of my clients, I say unreservedly that we are sorry. We are sorry that this should be so, that this happened when it should not have done. This is the beginning of a journey to uncover exactly what happened and why. But from those I represent, it begins with an expression of sorrow and regret.
Our correspondent Paul Kelso is following this story and is live for us now in central London. And Paul, will this apology be adequate for the victims and the victims' families?
Bluntly, no. What the victims want is the inquiry, the long-awaited public inquiry that began here at Church House in Westminster and has gone over the last 3 days. They want it to deliver truth, justice and accountability. Those are the three things campaigners repeatedly say that they want. But I think they have been encouraged by the last few days, and the significance of what we heard there from the Council for the Department of Health was an acknowledgement, perhaps for the first time, that there are a range of possibilities here, none of them good for the officials and perhaps some of the politicians who held office through the 70s, 80s and 90s when contaminated blood was in circulation. She said at very best there has been a lack of candour, a lawyerly phrase for people failing to tell the truth, and worst, a cover-up. And that's certainly the view of many here who've been affected by this. Up to 5,000 people infected and 3,000 killed, a number that is still rising. They've been encouraged by what Sir Brian Langstaff, the judge, has said. They have been shocked also by some of the things they've heard this morning. They heard from the Haemophilia Society's lawyers as they set out their opening statement, and that included documents that they've managed to get disclosed from government, official papers from Sir John Major, a letter from when he was Prime Minister in which he categorically ruled out paying any compensation from health funding to the victims, but suggesting that the National Lottery, which he just established and was set up for good causes, museums and sporting events and the like, might step in. And that really did cause consternation in the room, and I think has fueled the demands that politicians of the time should be called to account. I spoke to one victim, Chris Smith, a man who lost his father to HIV when he was just 8 years old. This was his reaction.
It's quite sickening in a way that now that I read that my father would have been better off buying a lottery ticket. The proof will be in the pudding of the actions that we get over the coming months to follow, really. We've had lots of promises before in the past, so to actually see one of these through, like with the whole entire inquiry, people are saying all of the right things, but we've heard this all before. What we actually need to start seeing is some form of action now.
So people leave here encouraged about what they've heard over the last 3 days. We won't hear anything else from this inquiry for 6 months now. They will go on with the information gathering before evidence begins being heard publicly again next spring. Sir Brian Langstaff, who's chairing this inquiry, vowed that he would continue working hard every day and would keep going, as he said, until the truth of this scandal has been discovered. That was met with a standing ovation, a mark of the gratitude from those who spent so long demanding an inquiry that something's finally been done. But a chastening thought, many more people will have died before this inquiry begins hearing again, and yet more before it reports.
Absolutely, Paul. Thank you very much indeed.